Today's topic is local anesthetics. So what is local anesthesia and what are the drugs which are used in promoting local anesthesia? Local anesthesia is nothing but it is the loss of sensation of a localized area causing depression of the excitation of nerve endings. So here what are we doing is like we are making the person to become unconscious or in the localized area itself, not the whole body, or he don't become unconsciousness. So here the localized part becomes numb, it loses its sensation. So this is called as local anesthesia. And this local anesthesia can be induced by various methods. So a few of the methods are like low temperature. So if we give at the particular area, if we give the low temperature or if we give chilled environment, it becomes numbness. The local area becomes numb and it loses its sensation. And the other method is mechanical trauma. So by giving the external mechanical injury or else mechanical if we give that some sort of mechanical strength, then it gives the numbness to the particular area. And the other one is anoxia. Anoxia is a condition where we decrease the oxygen supply. So if in the localized area if the oxygen supply is decreased, then that particular area will lose the sensation. And the other one is neurolytic agents like alcohol and phenol. So if we give or else if we apply alcohol or phenol at the particular area, then that area will lose the sensation. And finally the chemical agents which are called as local anesthetics. So these are the drugs which are induced either orally or they are injected either topically or they are given through IV route in order to induce local anesthesia. Local anesthetics. So these are the drugs which induce loss of sensation by reversible. In the sense, this loss of sensation is reversible. So we are inducing the loss of sensation, and again the person can gain the sensation after few moments. And these are used only in the localized area. The whole body is not losing its sensation. Only particular area is lost the sensation, and the person's consciousness is not affected. And the other one is when applied directly to the nerve tissues or mucous membrane. So here the local anesthesia is we can induce local anesthesia only when the injection or the local anesthetics are given to nerve tissues or else mucous membranes. In order for a local anesthesia to exhibit its actions, it has to have some properties. So it is a simple word. Remember the word instead. So the properties of the local anesthesia are given in this word itself. So I stands for it should not be irritating to the tissue. So if we apply or if we give through injection, it should not cause any irritation or damage to the tissue. The other one is N. N means it should not cause any permanent alteration of nerves. So if we are subjecting or if we are injecting the local anesthesia to the nerves, it should not cause any nerve damage or it should not alter any nerve functioning. And the other one is S. It is systemic. It shows systemic toxicity should be low. So if we are applying at the particular area, it should not cause any toxicity or it should not cause any sort of rashes or it should not cause any sort of hypersensitivity reactions where it is injected or applied. And the other one is T. The onset of time or else the time of onset of its action should be fast. So once we inject or once we administer the local anesthesia, it should show its effect. The delayed onset of action should not be the characteristic property of the local anesthesia. The other one is effective. So it should be effective once we apply. If it's not effective, then it's of no use to give local anesthetics. The other one is duration of action should be long. So for example, so if a person has to go some minor surgery which is not needed to give general anesthesia. So we are just applying the local anesthesia at a particular area and we have to do some minor surgery in that. So the duration of local anesthesia should be sufficient in order to during the surgery. So if the local anesthesia is having short duration of action and before completing the surgery itself the localized area gains the sensation, then the person may feel pain. So it should have enough duration of action in order to finish the procedure. Now let us compare the general anesthesia with the local anesthesia, how they are getting differentiated. So here, if we see the site of action of general anesthesia, it is affecting CNS. And if we see the local anesthesia, it is affecting peripheral nerves. And area of body involved. So if we give general anesthesia, whole body loses its consciousness. And in local anesthesia, it is only restricted to the particular area, that is to the localized area itself, unaffecting the consciousness of the person, and consciousness is lost in general anesthesia, whereas in local anesthesia it may be unaltered. And the vital functions, I mean the care of the vital functions, so whatever the vital organs are there, we have to take care of that organs in order to exhibit the proper function. So in the general anesthesia we have to take essential care for that, but in local anesthesia it's not that useful, or it's not that necessary to take care of the vital organs. And physical trespass, so physiological trespass for general anesthesia is high and for local anesthesia is low. And the health, patient's health, so regarding the patient's health, if we are giving general anesthesia, we have to take care of the proper, we have to take proper care, and we have to see the medical history of the person. If the person is not healthy, then it's not that safe to give general anesthesia. But if the person is not that healthy also, it is preferred to give local anesthesia. So in this condition, it is slightly risky to give general anesthesia. And use in non-cooperative patients. So here, if a person is not cooperating in order to inject or administer anesthesia, then general anesthesia, it's not possible if the patient won't cooperate. But if in local anesthesia, it is, in general anesthesia, it is possible for if a person even won't cooperate, it's preferable to give general anesthesia. But in local anesthesia, if a patient is not cooperating, it's not that easy to give local anesthesia. And for major surgeries, general anesthesia is preferred, whereas local anesthesia cannot be used. And for minor surgery, general anesthesia is not preferred, whereas local anesthesia can be preferred. Now let us see the classification of local anesthetics. So local anesthetics are categorized into two categories. One is injectable and the other one is surface agents. So injectables are further classified into three categories. One is low potency and short duration, intermediate potency and intermediate duration, as well as high potency and high duration. Whereas injectables are further classified into soluble anesthetics and insoluble anesthetics. So here, if we see the classification of injectable anesthetics, these are like low potency and low duration of action. The drugs which come under this category are procaine and chlorprocaine. And the drugs with intermediate potency and intermediate duration of action are lidocaine and prilocaine. Whereas the drugs which include, or else the drugs with high potency and high duration of action are tetracaine, bupivacaine, ropivacaine and dibucaine. Let us see the classification of surface anesthetics. So these are classified into soluble and insoluble. So the drugs which come under the category of soluble are cocaine, lidocaine, which is also called as lignocaine, tetracaine and benoxenate. So these are the drugs which are soluble in water. And the other one is insoluble drugs are benzocaine, butylamino benzoate and oxetazine. So oxetazine. So these are the drugs which are insoluble. Let us see the chemistry of the local anesthetics. So how structurally these local anesthetics are. So these local anesthetics are having amphiphilic property. So amphiphilic in the sense, in their structure they are having both hydrophilic and hydrophobic elements. So what is hydrophobic? Hydrophobic are those which are water hating. They are not having affinity towards water. Whereas hydrophilic are the substances or components which are water loving. They attract water easily. So in the local anesthetics we have both elements. We have hydrophilic as well as hydrophobic elements. That is the reason they are called as amphiphilic, or else they are having amphiphilic property. And these local anesthetics, both these hydrophobic as well as hydrophilic components of the local anesthesia are linked by either ester or amide linkage. So here these are the structures of procaine and lidocaine. So If we see here, these local anesthetics are weak bases. So they are like weak bases. They are, in the sense, they are having more acidic property. So here the aromatic ring portion, whatever is there, it is the hydrophobic part, whereas the amine portion, it is hydrophilic part. And this hydrophobic and hydrophilic part are linked together by the intermediate chain, which may be either ester or which may be either amide. So what will be the, what is the characteristic property of the aromatic ring? That is hydrophobic element. So this hydrophobic element is, the name itself indicates hydrophobic, in the sense it is also called as lipophilic. It is very affinity towards the lipids, and this lipid solubility is responsible in order for the drug to penetrate to the plasma membrane. So here, if the drug is having lipid solubility, it easily passes through the plasma membrane, and thereby it is having more potency and it is more effective. So here, in the same way, it is more soluble, and once it is soluble, it easily gets diffused into the plasma membrane, and that is the reason it is more potent. So if we take the example, so bupivacaine is more lipophilic when compared to the lidocaine. So that is the reason bupivacaine is more effective than lidocaine drug. And if we see the interlinkage or intermediate linkage, so if a local anesthetic which is having ester linkage, what are the characteristic features or properties it have, and if it is having amide linkage, what are the properties? So if a drug is having amide linkage or amide group, then it is more intense, so it is more potent, and it is not easily breakable. So the amide linkage, whatever is there, it is not that easily breakable, and that is the reason these local anesthesias are stable towards the metabolism, and these are long lasting drugs, and they are not hydrolyzed by the plasma esterases. So there are many plasma esterases enzymes which are present in the blood, and they break down the amide as well as whatever the linkages are there. So here, these amide, if amide linkage is there, they are susceptible to these they are not susceptible to these plasma esterases, and thereby the amide linkage is not that easily breakable, and they are heat stable. So if there is any in the sense, if even the temperature inside the body increases, that won't affect these structures, and that is the reason these amide containing local anesthetics can be autoclaved. So if they are autoclaved, they are getting sterilized, and if they are administered also, the hypersensitivity reactions are very rare with these kind of drugs, and the infiltration and block, so they are not filtered that easily, and thereby they are getting blocked. And the examples which come under this category are lidocaine, prilocaine, and bupivacaine. So here we can see the amide linkage, so where the double bond oxygen is attached to the NH group and the ester group. So these ester groups are having less intensive, they are less potent than the amide containing local anesthetics, and they are easily breakable, and that is the reason they are not stable, and they are having short duration of action, and they can be easily hydrolyzed by the plasma esters, and they are not stable with heat. So that is the reason they can't be autoclaved. Some other sterilization procedures have to be followed in order to sterilize these ester containing local anesthetics, and they are having high risk of hypersensitivity reactions. So we have to take care while we are administering in order to prevent these hypersensitivity reactions, and these are applied topically. And the example which come under this category are procaine, cocaine, and benzocaine. So here we can see the ester linkage where it is containing COO group, that is C double bond O, which is attached with the oxygen group. So these are esters. So amides, esters are having quite opposite characteristic features to that of the amide. So that is the reason amides are more effective when compared to the ester carrying local anesthetics. So the terminal hydrophilic nature. So the term, what is the what function or what is the properties of these hydrophilic containing, or is the hydrophilic component which is present in the local anesthetics. So these are, first thing, they are hydrophilic in nature and they are containing secondary or tertiary amines. So if we see hydrophobic structure or hydrophobic element, it is an aromatic ring structure, but here this is secondary, or it's containing tertiary or secondary amines in its structure, and it is responsible for the pKa of the local anesthesia. So pKa is nothing but the capacity of the component in order to get dissociated in the presence of acid. So this is called as the pKa coefficient or dissociation coefficient, and if these are responsible for the pKa characteristic of the local anesthetic. So if this if the pKa is high, then they are more prone to dissociation. So here, if the drug is having, or local anesthesia is having less pKa value, that is closer to, if the pH is around 7.4, if the pH is alkaline pH, then they are having less pKa values. And here, that is if they are having less pKa value and they are more potent, or they are having greater action. If they are having greater pKa value, then they are less potent. So now let us see the classification according to the chemistry. So we saw ester linkages and amide linkages. So the local anesthesia which are containing ester linkages are cocaine, procaine, chlorprocaine, tetracaine and benzocaine, whereas the local anesthesia which are containing amide linkages are lidocaine, bupivacaine, dibucaine, prilocaine and ropivacaine. Cocaine is the first local anesthesia which is discovered, and it is a naturally occurring plant alkaloid from the plant called as Erythroxylon coca. So this is one of the prototype drug from which the lignocaine is synthetically prepared. So cocaine is the first local anesthesia, and from which the lignocaine is synthetically prepared in order to show its local anesthetic action. Now let us see the mechanism of action of these local anesthetics. So here, these local anesthesia at the terminals or at the nerve endings, what they do, they are getting, these local anesthesias are injected in the form of salts. So here, once we inject this local anesthesia in the form of salts at the nerve endings or at the nerve membranes, they get dissociated because of the pKa, because of the amine hydrophilic group which is responsible for the dissociation of these local anesthetics. They get dissociated into the component which is containing aromatic ring, and it is dissociated into the protons. So this one, which is the neutral one which is there, then only it crosses the then only it crosses the neuronal membrane. So if it is in the form of salts, it's not possible for it to cross through the neuronal membrane, because ions cannot cross through the plasma membrane or neuronal membrane. So that is the reason it is getting dissociated, and thereby it can enter into the neuronal membrane. And here we can see the pictorial representation where the B in the sense the local anesthesia here. So it is getting dissociated into the local anesthetic form, that is neural form, and the other one is the proton. So here the one which are in the form of salts, they block the entry of the sodium into the plasma membrane or into the membrane, whereby they are preventing the depolarization of the cell. So if the cell is not depolarized, then it becomes, it will not induce pain, and thereby they can show the local anesthetic effect. Here, if we see how they are blocking, how these local anesthetics are acting on the sodium ionic channels. Here, once the local anesthetics are injected, they block the sodium channels. So they won't allow the sodium to allow into the they won't allow the entry of the sodium into the plasma membrane. If the sodium enters, it will undergo depolarization, and thereby, because of the depolarization, the action potential is generated in the plasma membrane. So if action potential is generated, it sends some impulses to the brain in order to induce pain. So here, if the entry of sodium is blocked, this local anesthetics will block the entry of sodium, and thereby they are not allowing the depolarization of the cell, and ultimate result is the pain is not induced. And here we can see the pictorial representation. Here the sodium channels are present in 3 states. One is resting state, activated state and inactivated state. So here in the sodium channels we are having the local anesthesia receptor. So these local anesthesias, they go and bind to the local anesthetic receptors which are present in the sodium channels. So if it is in the resting state, so here the sodium channel is not blocked, but it won't allow the entry of the sodium into the plasma membrane if it is in the resting state. But if it is in the active state, the sodium channels are opened and the sodium entry is allowed into the cell in order to promote depolarization. But here, if it is in the inactive state, the entry can be allowed. I mean, in the sense the entry through the ionic channels can be allowed, but the ionic channel is blocked. Once it is blocked, it is not allowing the sodiums to enter completely into the plasma membrane, and it won't even allow the sodium ions which are present inside the membrane to move out of the plasma membrane. So these are the states. So only the entry can be allowed if it is in the activated state, but the exit is not possible if the sodium channel is in the inactivated state. So these local anesthetics, they bind to the local anesthetic receptor and they won't allow the sodium to enter into the plasma membrane. Now we'll see how the order of blockade is taking place. So here first, when we inject the local anesthesia, the autonomic nervous system or the autonomic region is getting paralyzed, and thereby once the autonomic nervous system is blocked, it won't induce pain, and if won't induce pain, the temperature is lost, and once the temperature is lost, the person loses the sensation. And if the sensation is lost and if the sensation persists for longer period of time, then it undergoes the pressure inside the body increases, and thereby the motor nerve is impaired. But here, once the local anesthesia is getting eliminated out of the body, and once a person gets the sensation, the recovery of the sensation is in the reverse order. First, here the motor nerves are getting relieved from their numbness, and next the pressure inside decreases, whereby the person can feel touch or the person can feel sensation, and the temperature becomes to the normal state, and thereby the person can feel pain, whereby the autonomous nervous functioning is proper. So in this way, the order of recovery is quite reverse to the order of blockade. Let us see the actions of local anesthetics. So how these local anesthetics are acting at various parts of the body. So here, once we administer local anesthetics on the CNS, especially cocaine. Cocaine is such a drug which is a CNS stimulant. So once it is administered, it causes excitation of the central nervous system. So if we take example, the people take tea where it is containing cocaine, so caffeine or cocaine, so it causes the excitation of the, or else it, once they have tea, their mind works faster, or their mind becomes sharp. So this is because of the caffeine which is present. So in the same way, cocaine is also a CNS stimulant where it causes the proper functioning of the central nervous system. And procaine is a local anesthetic which is less potent when compared to other local anesthetics. And lidocaine, if we administer lidocaine to a person, first initially it causes little drowsiness, and thereby it may cause allergic reactions. And the other one is, at higher doses, it produces excitation followed by depression. So if we give the lidocaine in the normal proportion, then it causes drowsiness and it may cause lethargy. And if it is if we give it in higher doses, then it may cause excitation, which is quite opposite. We can say which is quite antagonistic effect than its normal effect. Here we can see the how they are acting on the CNS. First, it causes euphoria condition where the person feels pleasure in having that local anesthesia, and then it causes excitement of the central nervous system, and then the person mental confusion. The mental state of the person is impaired, and the other one is, because of the mental confusion, it may cause restlessness, and if the person is undergoing restlessness, there occurs the stress, and thereby there are chances of getting tremors, and once the tremors are there, it causes twitching of the muscle, and finally it leads to the convulsions. So if a person is having convulsions, the person becomes unconsciousness, and it leads to respiratory depression, finally leading to the death of the person. So if the local anesthetic activity stays for longer period of time, then it shows all these effects on the central nervous system. So how they are acting on the cardiovascular system. So what are the effects of these local anesthetics on cardiovascular system? Firstly, they causes cardiac depression. So as the nerve impulses are impaired, or the impulses which are generated at the nerve endings are impaired, then it causes cardiac depression. So if cardiac depression is caused, then it may lead to fall in blood pressure. So the blood pressure will be lowered, and the drugs like bupivacaine, it causes vasodilatation. It causes dilatation of the blood vessels, whereas cocaine like drugs, it causes vasoconstriction. It will causes constriction of the blood vessels. Let us see the pharmacokinetics. So what happens to a local anesthetic drug once it is entering into the body? So here the absorption of the local anesthesia is based on various parameters like dosage, site of injection, lipid solubility and vascularity. So if we are giving, it is dose dependent. So based on the dose, the absorption of the local anesthesia is depending. So if the dose is lower, it gets absorbed easily, and if the dose is higher, it is getting absorbed little delayed. And site of injection, so where we are applying, that also depends, because in our body the organs, a few organs are having greater vasculature and few organs are having lesser vasculature. For example, if we give through injection form, it directly enters into the blood circulation, and thereby the absorption of the drug is almost up to 100%. But in the same way, if we are applying topically, it takes some time in order for the drug to reach the systemic circulation. So and lipid solubility, so few are in the sense how much lipid solubility the drug is having. If the drug is highly lipidic in nature, it is getting more absorbed, and if the drug is less lipidic in nature, then it is absorbed a little less. And vasculature, so here if the place where, or the local area where the local anesthesia is applied, then the site of action or the localized area, if it is highly vasculature, if it is containing high vascular blood vessels, then it is getting absorbed more, and if it is having less vasculature, it is getting absorbed lower. So here these local anesthesias should be, if they are given in combination with the vasoconstrictors, so it may cause quite opposite effect, or else we can say they are nullifying the effect of vasoconstrictors. So except cocaine, most of the local anesthetics are vasodilatation in their nature. So here if we give the cocaine with the vasoconstrictors, it may show synergistic effect, but if we combine the local anesthetics with the vasoconstrictors, then it may show the reverse effect. In the sense, they won't allow the vasoconstrictors to show their vasoconstrictive effect. And the distribution, so this local anesthetics, even the distribution is also based on the site of injection. So if we are injecting directly into the systemic circulation, the local anesthesia, if it is hydrophilic in nature, it is easily solubilized in the systemic circulation and it is evenly distributed. So if it is not hydrophilic in nature, then the distribution of the local anesthesia is low when compared to hydrophilic local anesthetics. And biotransformation, so once the local anesthesias are distributed, they undergo metabolism. So biotransformation is one of the metabolic reaction which is occurring in the body. So these local anesthesias are metabolized with the biotransformation reaction, and these metabolites are excreted out through urine. Now let us see let us compare the characteristics of few local anesthetics. So here the procaine is having slow onset of action, and the pKa value of the local anesthesia is 8.9. pKa value of the procaine is 8.9. So if a drug is having less pKa, that is dissociation constant value, it is more potent. So here the duration of action of procaine is very less, short, and the vasodilatation effect is more. So procaine causes vasodilatation, and plasma protein binding is up to 5%. So if the plasma binding capacity is lower, then it can show, it is having longer duration of action, in the sense it is available in the systemic circulation for longer period of time, so that it can show its effect. And if we observe lidocaine, it is having a rapid onset of action, and the pKa value is 7.9, and the local duration, the duration of action of this local anesthesia is moderate, and it is also a greater vasodilatation effect, and the plasma protein binding is up to 55%. So here the lidocaine is, once we administer lidocaine, 55% of the lidocaine is getting binded to the plasma proteins, and thereby it is not showing its effect. Only 45% of the drug is able to show its effect. So whatever the leftover drug which is not binded or unbound, that is showing the effective local anesthetic action. And the drug tetracaine, it is also having slow onset of action, and the pKa value of this drug is about 8.5, and it is also having longer duration of action. So when compared to procaine and lidocaine, this is having a lower vasodilatory effect, and plasma protein binding capacity is up to 75%. And the drug bupivacaine, it is also having slow onset of action, and the pKa value is 8.1 with a longer duration of action and less vasodilatory effect when compared to other drugs. And the plasma binding capacity of this bupivacaine is around 90%. So only 10% of the drug is effective. So when compared to all these four drugs, lidocaine is having more effect or more rapid onset of action and more potent when compared to other drugs. But here if we see chemically or structurally, bupivacaine is more effective than lidocaine. Let us see the adverse effects of these local anesthetics. So first, they cause CNS depression, in the sense, first they cause excitation of the CNS and then followed by the depression, and it causes local neurotoxicity. So if it is applied to the renal area, then it may if we apply to the localized area, it may cause toxic to the neurons which are present or to the nerves which are present in the localized area. And in the CNS, especially the bupivacaine drug, it is more cardiotoxic when compared to other local anesthetics, and it may cause improper functioning of the autonomic nervous system, and it may cause motor paralysis. It may paralyze the motor neurons and thereby impairing the motor function, and hematological effects. So it may cause the hemolysis of the RBC and thereby leading to the RBC death, and it may cause hypersensitivity reactions. So if we use the local anesthesia for chronic period of time, it may show all these adverse effects. So let us see the individual drugs. So cocaine is a drug which is used as a surface or topical anesthesia. So this is applied surface, but it is not given through, it is not administered either through oral or IV. And we should not give a cocaine with epinephrine, because if we give, cocaine is a potent vasoconstrictor. So epinephrine is also a vasoconstrictor. So if we combine these two drugs, it may show synergistic effect, and it is toxic on heart, and it may induce the cardiotoxicity. So we should not administer this cocaine directly to the heart, or else we have to make sure that the dose of the cocaine is in such a way that it is not causing any cardiotoxic effects, and it may cause pyrexia with the overdose of cocaine. So pyrexia, it will it may increase fever, or it may increase temperature in the body. So on overdosage of cocaine, it may cause fever to the person. So here we can see the side effects of cocaine in the brain. It may reduce attention, and it may cause insomnia, that is sleeplessness, or it may even induce hypersomnia also, where the person sleeps over, or else we can say the person will always feel sleepy, and it may cause lethargy, that is tiredness, and it may have sore throat and chest pain, asthma, bronchospasm, fever, rhinorrhea, that is running nose, and this increased risk of infarction, the heart tissue. Because of the cardiotoxic effect, it may show, it may cause myocardial infarction on delayed, or on chronic use of this cocaine, and it may cause pruritus. This is one of the allergic reactions to the skin. So these are a few of the side effects of the cocaine. The other drug is benzocaine. So benzocaine is available in the preparations, in the sense it is also a surface or topical agent, where it is available in the form of sprays. So here it is sprayed in order to relieve the pain, and it even won't cause any irritation also. And this is a surface anesthesia. So we are just applying on the surface of the skin, or it is applied topically through the spray or even through ointments also. And it is used to produce anesthesia of the mucous membrane. membrane. So if we have to produce or if we have to cause numbness to the mucosal membrane, then this benzocaine is more preferable, and it induces methemoglobinemia. So if we use benzocaine for longer period of time, it may cause methemoglobinemia. So this methemoglobinemia is a condition where the methemoglobin is produced, where the ferric form of methemoglobin is a compound where in the hemoglobin structure we contain ferric ion, that is Fe2+. So this ferric ion is converted to Fe3+, where a methyl group is attached to the heme group and it forms methemoglobin. Thereby it is decreasing the oxygen carrying capacity of the hemoglobin or RBC. The other drug is lidocaine or lignocaine. This is most widely used local anesthetic agent, and it is most comfortable to give this lidocaine also, and it is effective in all routes. Either we give through topical route or injectable route, it is effective, and it is having faster onset of action. We have seen the characteristic properties of lidocaine. It is having faster onset of action, and it is having even a duration of action also for longer period of time, and it is better, or else we can say it is more potent than procaine. And see, if a person, or if the ester containing local anesthetics are having any allergic reactions, so to these persons or to such kind of persons, this lidocaine is more preferable, as it is containing amide linkage in its structure, and it is more potent than procaine, but it is equally toxic to the potent also. How effective it is, and at the same time it is that toxic also, and it is having sedatory effects when compared to others. The other drug is bupivacaine. So bupivacaine can be administered through injectable because it is not that effective when we administer it topically. So that is the reason it is preferable to give through the route of IV, and it is having slower onset of action, but it is having longer duration of action. But it is having a unique characteristic feature when compared to other local anesthetics, is that it causes sensory and motor dissociation. So it will cause the sensory and motor dissociation, whereby it is minimizing the analgesia, and thereby it blocks the analgesic, or else we can say it is not causing, or else it is blocking the analgesia action of the CNS, and it is cardiotoxic when compared to other local anesthetics. The other drug is ropivacaine. So ropivacaine is an enantiomer of bupivacaine. So enantiomers are the chemical structures which are mirror images. For example, if we see the structure of bupivacaine, and if we see the structure of bupivacaine in the mirror, how it looks, that is ropivacaine. So it is the mirror image of bupivacaine, and enantiomers are nothing but mirror images, and this is also not topically effective. So as bupivacaine is not that effective topically, so this is also not effective, and this is preferably given through IV route, and it is clinically equivalent to bupivacaine because it is as it is the enantiomer, it is having the equal action to that of the bupivacaine. So it is also more it is also potent as that of bupivacaine, and it is also having the similar characteristic feature of the sensory and motor dissociation of the CNS. Now let us see the clinical uses of these local anesthetics. So here the drugs like tetracaine, lignocaine, cocaine and benzocaine, they are used in the surface anesthesia, and in the infiltration anesthesia and field block anesthesia, the drugs like lignocaine, procaine and bupivacaine are preferred. And for the nerve block anesthesia, the drugs like procaine, lignocaine, bupivacaine, tetracaine and ropivacaine are preferred. For spinal anesthesia, lignocaine, tetracaine and bupivacaine are given. And for epidural anesthesia, the lignocaine and bupivacaine are the drug of choice. And for the drugs, for the anesthesia used in ophthalmology, the drug like proparacaine is used. So here if we compare the site of action where these local anesthetics are acting and uses of these uses of surface anesthesia. So here at the site of eye, The drugs which are used are tetracaine in the dose of 1 to 2% and benoxynate at 0.4%, and these drugs are formulated in the form of ointments or drops. So in the eye, in order to cause anesthesia at the eye, we have to give either drops or ointment, and the purpose is that in order to do tonometry, it is a surgical procedure. So in order to induce that surgical procedure, these ointments or drops are preferred. And for nose and ear, the drugs like lidocaine at the dose of 2 to 4% and tetracaine at the dose of 1 to 2%, which are formulated in the form of drops, and they are used to relieve the painful lesions. So if there are any painful lesions, in order to relieve that, in order to relieve the pain, these drugs are preferred. And for mouth and throat, the drug benzocaine is preferred in the form of lozenges. So lozenges are the formulated preparations which causes soothing of the throat. So these are the formulations. Once administered, they cause soothing of the throat, and they are used for the purpose of if a person is having stomatitis or sore throat. So these formulations are preferred, and to cause anesthesia at pharynx, larynx, trachea, and bronchial region, the drugs like lidocaine at the dose of 2 to 4% and tetracaine at 1 to 2%, they are formulated in the form of sprays. So if we have to cause anesthesia in the pharynx or throat region, then we have to give these sprays and the anesthesia is caused. These are preferred in order to do endoscopies. And for esophagus and stomach, the drug oxytocin at the dose of 0.2% in the form of suspension is given. So this is the oral formulation where it is formulated in the form of suspension, and it is used for the purpose of gastritis, esophagitis, and if there is any heartburn, these are used. And if there is any skin damage for the abraded skin, that is the skin which is not in touch or intact, so for that we have to give tetracaine, benzocaine, and butamben in the form of cream, ointment, and dusting powder. For example, the skin surface or the deepest layer of the skin, in order for the drug to reach that, so these formulations are preferred, and these are mostly used for the purpose of ulcers, burns, and itching dermatosis. And for intact skin, which are directly in contact with the skin, the drugs like prilocaine at 5% is given in the form of cream under occlusion. So it is mostly given through cream, and we can directly apply the cream on that particular area. And this is also used for IV cannulation and skin surgery. So in order for cannulation procedures and for skin surgeries, this prilocaine is preferred. And for urethra, the drug lidocaine at the 2% in the form of jelly is preferred. So we have to apply the jelly, and thereby it is used for the dilatation of the urethra. And for anal canal and rectum region, the drugs like lidocaine 4%, dibucaine 1%, and benzocaine 5% is given in the form of ointment, cream, or suppositories. So suppositories are the formulations which are directly injected through the rectal route, and these are used for the purpose of if the person is having piles, or for the surgery, for surgical procedures of anal or rectal region, or to fissure, or for the fissures, these local anesthesias are preferred. Spinal anesthesia. So spinal anesthesia is an anesthesia which is caused to the spinal region. So we are directly injecting the local anesthesia to the spinal cord, and thereby it causes the anesthetic effect to the spinal region. Here, what are the complications which are involved if the local anesthesia is given directly to the spinal cord, or spinal anesthesia is induced? So it may cause respiratory paralysis. It will paralyze the respiratory, and thereby it causes difficulty in the breathing, and it may cause hypotension where the blood pressure is decreased, and it may cause severe headache, and it may cause cauda equina syndrome. So this is a condition where it is causing swelling and it is increasing pressure at the nerve endings which are present in the spinal cord. So in the spinal region, whatever the nerves are present to the nerve endings, there occurs increased pressure and swelling in that particular area, and it causes septic meningitis, and to the meningeal region it may cause infection or sepsis, and it may induce nausea and vomiting. So these are the complications which are involved in the spinal anesthesia. So proper care have to be taken if the spinal anesthesia is induced.